Okay, my lecture will be on the combination of Chinese herbs and acupuncture in the treatment of infertility, and we checked the effect on sperm characteristic. Chinese medicine is known already for 2,500 years at least as an efficient method for treating many and varied health disorders. Our study deals with the integration of traditional Chinese medicine, TCM, conventional medicine of treating couples who have failed to conceive after conventional treatment for infertility between 3 to 15 ART cycles attempts. Some basic concepts in Chinese medicine. So pathologies appear due to internal or external causes and or causes of excess or deficiency. The diagnosis is done by 4 basic methods: interrogating the patient, observing, pulse taking, hearing and smelling. The treatment strategies are chosen according to the 8 principles: interior, exterior, cold versus heat, deficiency, excess, yin and yang. I will explain them. Interior and exterior means, does the disharmony occur due to internal causes such as organ dysfunctions, emotional distress, or due to external pathogens such as microorganisms, toxins, climatic conditions, food intake? The cold and heat means, do the signs and symptoms show tendency for heat or cold? Deficiency and excess means, is there a significant deficiency of qi, blood, yin, jing, or yang, or a significant excess due to stagnation, accumulation of the above substances? Yin and yang mean, does the overall picture have a yang or yin character? TCM treatment use Chinese herbal medicine. The Chinese Materia Medica, a pharmacological reference book used by the TCM practitioners, contains hundreds of medical substances, primarily plants but also some minerals and animal products. Usually herbs are combined in formulas and are given as teas, capsules, tinctures or powders. Doesn't move on. Okay. Acupuncture is done by stimulating specific points on the body, most often inserting thin metal needles through the skins. Practitioner seeks to remove blockages in the flow of qi. The causes of male infertility, according to the traditional Chinese medicine, divided to an excess syndromes and deficiency syndrome. As for the excess syndromes, damp heat accumulating in the lower body is the main syndrome. For the deficiency, kidney jing, yin and yang is the main syndrome. The kidney, according to the Chinese medicine, stores the essence and dominating reproduction, growth and development. As for the clinical signs, in damp heat in the lower body, the major signs and symptoms are tendency or aversion to heat, red complexion, red tongue body with thick, greasy yellow fur, and the pulse is wiry and rapid. This syndrome might be parallel to infertility due to varicocele or partial obstruction in the sperm vessels. In kidney jing deficiency, the signs and symptoms are aging, weak and sore back and knees, loss of hair or gray hair, blurred vision, pale and moist tongue body, weak or empty pulse in kidney position. In those patients, tendency for low sperm volume, concentration, motility, and morphology observed. Here on the right you see damp heat in the lower body, and on the left a kidney deficiency. The aim of our current study was to determine the effect of the combination of Chinese herbs and acupuncture on male partners of couples who failed to conceive in their previous ART attempts. The material and method. The study was conducted on 12 couples who failed to conceive in at least 3 previous ART cycles attempts. Patients were analyzed according to the 8 principles of the Chinese medicine. Daily administration of herbal formulas and weekly regime of acupuncture treatments were individually designed for each of the partners in each couple. Sperm analysis took place before the beginning of the treatments. Volume of ejaculate, pH, sperm concentration, sperm motility, and sperm morphology were recorded. Sperm analysis were statistically analyzed and compared with the second analysis taking on the 40 days in average of the treatments. The outcome was also compared with the outcome of control group, which consisted of 12 patients who underwent 2 sperm analyses during this period of time. The results. A comparison of sperm parameters before and after 40 days of treatment using a PERT test revealed the following. There were no significant change in the total motility or sperm concentration. However, there was a significant change in the volume of ejaculate and even more in the morphology. Here you can see the comparison between the test group in blue and the control group in purple. Here is the comparison of the sperm morphology of the individual patients. Another result is the outcome of the pregnancies. We got out of 12 couples, 6 pregnancies were achieved, and delivery took place as follows. I don't know if you can see, but the average age of the female was 39. And we got 50% pregnancy rate. The conclusion is that a combination of acupuncture and Chinese herbs may be a useful, non-traumatic, supporting treatment for males of couples which failed to conceive in ART and intend to undergo further fertility treatments. Anyway, further investigation is still taking place. I would like to acknowledge Dr. Guy Casuto and my colleagues Tal Bello and Dr. Yona Barak and the Kibbuzim College Tel Aviv, Israel, and Chengdu University of TCM, China, where I gained all my knowledge in TCM. Thank you. If there are any questions, I'll be happy to answer.